Hi, my name is Dr. Scott Timms. I am the Assistant Vice President for Campus Health. We'd like to welcome you all to our webinar today about campus health resources for graduate and professional students. We're going to get started in just a couple of minutes. So just saying. So hi, thank you all for joining us today. I'm very excited to be sharing with you information about our resources. Today you'll be hearing about all of the campus health services, including the WELL, which is the Center for Wellness and Health Promotion, Lindsay Greason, the director, counseling and psychological services presented by Dr. Donna Bender, and you'll be hearing from Dr. Daniel Garrett, director of the Student Health Centers, both uptown and downtown. So for our agenda today, we're going to talk about health, wellness, and academic success. We'll be talking to you about the Student Health Centers, counseling and psychological services, and the Center for Wellness and Health Promotion. We make up a conglomerate which we now refer to as Campus Health, which covers a variety of services and information. Just so you know, today's webinar is being recorded. We will be answering questions at the end. So please feel free to type those into the question box through the webinar system, and we'll be answering those at the end. We will also have our insurance specialist available should you have specific student health insurance plan questions. Having a little bit of technical difficulty with our slides advancing, so I'm going to put you on mute, and I'll be right back. So when we talk about the mission of Campus Health, we're all about emphasizing resilience, self-care, and initiative. The mission of Campus Health is to facilitate the Tulane community's well-being, guided by our dedication to inspire and support lifelong learners. Our medical, mental health, and health promotion departments strive to empower our students to take charge of their university experience and grow towards their fullest potential. So we really look at very broadly how can we impact all of our students from undergraduate, graduate, and professional to help them really achieve and do as well as they can during their time here at Tulane. When we talk about health, we really look at health from a very broad definition, and health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. We look at a variety of ways to impact the health of our students, and through all of the different departments that make up Campus Health, we really try to provide a comprehensive experience for students to help keep them healthy, happy, and able to do well academically. When we talk about our graduate professional students, we have data from the National College Health Assessment, which is collected every 2 years here. And our top academic impediments for graduate professional students tend to be depression, cold, flu, sore throat, sleep difficulties, anxiety, and stress. And these have stayed consistent for us over the last several years as we've looked at graduate professional student health. This is different, but similar to what we see for our undergraduates. We definitely recognize that graduate professional students have some different health needs and really work to make sure that we're providing new programs to help them be successful. And I'm going to turn it over now to Dr. Daniel Garrett to talk to you about the student health centers.
Good afternoon, everyone. Thank you for letting me join you today. My name is Dr. Daniel Garrett, and I'd like to speak to you about our Tulane Student Health Centers, our two locations. These are photos of the photos up on the top are the photos of the downtown Student Health Center, and the bottom photo is the picture of the outside of our uptown Student Health Center. So our purpose at the Student Health Center is committed to improving the overall health of our student community by providing comprehensive quality care and service in a compassionate manner. A holistic approach to health and wellness provides the best care to every patient through an integrated clinical practice. So it's our job is to provide you the services that you need in a holistic approach to health and wellness. On our staff, we have 4 physicians, 3 nurse practitioners, registered nurses, and a registered dietitian. Within our physicians, we have board-certified physicians in internal medicine, pediatrics, and adolescent medicine. Our nurse practitioners are devoted to family nurse practitioners and advanced nurse practitioners. Within our primary care clinic, most people often think of health in terms of physical health, and that's where you would go for primary care for your most common health needs. The Student Health Center is a place to go on campus when you're sick or want a regular checkup with a provider. As I mentioned, we are staffed by trained board-certified physicians, nurse practitioners, and registered nurses, as well as other support staff with a particular training and experience in college health. These individuals are dedicated to providing high-quality health care to our students. The Student Health Center general primary care provides general primary care, or you can visit us in the preventative health clinic for more specialized needs. The Student Health Center also has a pharmacy, which is a convenient and inexpensive place to pick up your prescriptions or over-the-counter medications. The pharmacy takes other health insurance plans to pay for your prescriptions. This fall, we are planning on free flu immunization clinics at the Student Health Center and our locations on campus, and I'll be showing you that schedule in a few moments. In our uptown services, our primary care clinic, which is located on the 2nd floor of the Student Health Center, building number 92 on campus, provides acute and chronic medical management. So if you have a routine cough or cold, sore throat, we are more than happy to provide you services in regards to those needs. If you have an ongoing chronic medical condition, our physicians and nurse practitioners are trained to provide care for those ongoing medical concerns and issues. We provide travel physicals, Peace Corps physicals, as well as routine general medical exams. We have providers on staff that can provide Accutane for acne management. We provide simple in-house procedures such as suture placement and removal, nebulizer treatments, and IV fluids as needed. This is just a short list of items that we care for. So we are more than happy to provide you services on campus or provide you resources off campus if need be. In our preventive health clinic, which is on the 3rd floor of the Student Health Center on the Uptown campus, we have a women's health department, which is run by dedicated nurse practitioners who specialize in women's health needs, such as STD evaluations, vaginitis, UTI care, We also provide several options for birth control, such as IUD insertions, Nexplanon, and again, other birth control options that are available. We also have a men's clinic, which specializes in men's health needs, such as STD evaluations and common genital urinary issues. We also have psychiatry service on our third floor, which provides psychiatric services to those students in need. We have lab services both on the second and third floor where you can get simple in-house labs that can be drawn and be provided results the same day. They can also collect samples that need to be sent off and have further analysis to other labs and other lab services. On our third floor, we have an allergy and immunization clinic. So if students are receiving allergy injections, we can continue to provide those allergy injections through their time here at Tulane. If you needed an immunization such as a tetanus update, a flu shot, we can provide those in our immunization clinic. We also have a travel clinic for our students who are traveling abroad or overseas. This clinic is run by our nurses and is overseen by the medical providers in the clinic. The nurses can provide you education and counseling on travel needs, provide prescriptions for certain medical conditions such as traveler's diarrhea or eye drops for prescriptions if need be. They also can recommend immunizations and malaria prophylaxis as needed based on your itinerary. We also have a medical records department on the third floor, which can provide you your medical records and give you updates in terms of how to access your medical records or immunizations. Our downtown student health center, which is located in the Elks building, room 206, also provides primary care services, immunizations, routine women visits or GYN visits, also has a full service lab, a travel clinic, and has counseling and psychological services in the building as well. Additional services that we offer with Student Health Center, we have online scheduling for our Uptown Clinic, which allows for flexible scheduling for our students here at the Student Health Center. We have a self-check-in process through our kiosks, which allows for better privacy for our students who are accessing us for care. We have a referral coordinator who assists patients in regards to scheduling off-campus appointments, and she works with the students to schedule those appointments around your class schedule. We have an immunization compliance module, which maintains accurate immunization records on our Tulane students. It allows you to upload your own immunization records to our medical records department for review and gives you feedback if you're missing any immunizations based on requirements here at the university. You can also access your immunization records if you're matriculating off campus and need those records for other services or other universities, or for your own personal record. Some initiatives that we have here at the Student Health Center. We have a multidisciplinary eating disorder team, which is run by our registered dietitian, 2 primary care physicians, and a CAPS psychologist, or counseling and psychological services psychologist. We also have a gender and sexual health clinic, which is dedicated to providing services to our trans students. This is a dedicated space and time for students going through their gender journey. We can provide a preferred name as well as preferred gender pronouns for those individuals requesting those services. This is a new initiative for us here at the Health Center, and we're very excited about the opportunity to work with our students who are going through a transition. We have after-hours services. This after-hours service is called Phone Med, and you can see the phone number here listed. This is a dedicated service run by nurses who are up 24/7 to provide you care and recommendations such as self-care or evaluation by a provider at the time of the call. So these nurses would encourage you to be at the Student Health Center first thing in the morning, if that's recommended based on the protocols that they go through in terms of asking questions regarding your current need. They can also recommend going to an urgent care center if need be, or to an emergency room. The Student Health Center receives the reports from PhoneMed the following day and allows us to follow up with the student the following day to assess and see if the student needs any ongoing care or assistance from us at the Student Health Center. This is a service that we've been offering for some time for our students here at Tulane, and we find it to be very beneficial for our students and provides a safety net for our students after hours. This is a calendar of our free flu clinics. As you can see, through the month of October, we are doing free flu shots at the downtown location on Mondays and Thursdays throughout the month of October. And that is going on from 1 to 3 o'clock in the afternoon. On Thursdays, on Mondays, it's 10 a.m. to 12 p.m. The Uptown Student Health Center provides free flu shots Tuesday, Wednesday, and Thursdays from the hours of 11 to 2. That is on the third floor of the Student Health Center. You will need your splash card to get your free flu shot. So make sure you bring that with you at the time of your visit. In the month of November, we have 3 days in which we are going to residence halls. We will be at Sharp Hall on November 3rd, Monroe Hall on November 4th, and Butler Hall on November 5th. These flu shots will be a $20 fee for those, and the times for those flu shots are from 3 p.m. to 5 p.m. We're also offering immunizations or free flu shots in November on November 17th and 19th at Bruff Commons. This again is a $20 flu shot, and it's from 11 a.m. to 1 p.m. During the Wellness Wednesday on October 21st, we'll be offering free flu shots from 11 to 1 at Pocket Park. And on November 18th, from 11 to 1 during our Wellness Wednesday, we will be offering flu shots at Pocket Park as well. I appreciate the time to speak with you this afternoon. Now I'm going to turn it over to Dr. Donna Bender, who is the Director of our Counseling and Psychological Services Department, or CAPS.
Good afternoon, everyone. Thank you for joining us today. And thank you, Dr. Garrett, for that introduction. I am Dr. Donna Bender, and I'm a clinical psychologist and the director of CAPS, Counseling and Psychological Services. We are the Tulane clinic that solely assists Tulane students in when they need help with mental health issues. So who are we? We are staffed at CAPS by patient care representatives, and these are the folks you will encounter first when you come into our clinics. They are the ones who help set up appointments and help get you settled in the waiting room and so forth. They are the frontline folks and very helpful. And then for clinical needs, we have professional counselors, social workers, psychologists, and psychiatrists on our staff. And our clinic, just for your information, is solely dedicated to the needs of Tulane students. We do not offer any therapy or services for staff. It's just for you, the students. So our official purpose statement is CAPS is committed to providing a safe, inclusive, and affirming community of care for all students. Our interdisciplinary team fosters personal, emotional, and academic well-being by offering comprehensive therapeutic services, outreach and prevention programs, and consultative relationships throughout Tulane University. So while we don't offer services to faculty and staff, what we try to do is provide assistance to them to be up to date on the latest information about mental health and mental well-being so that they can also be partners in assisting students. So our clinic has several locations. You're looking here at the main Uptown location, which is building number 14 in the Engineering and Science Lab building. If you should need psychiatric services, our psychiatrists are located on the 3rd floor of the Student Health Center Uptown. We also, as Dr. Garrett mentioned, have therapists in the Downtown Student Health Center at Elk Place, and you can see here on the map where Elk Place is located. So just to sketch out quickly our services, we can offer short-term individual and group counseling, psychiatric evaluations, and short-term medication management. We have a care coordinator, and I'll describe these services a little further in a minute. We offer crisis and walk-in services and a hotline, and I'll detail those further too. And we also do outreach. So how to access our services. You can call up for an appointment, you can stop by and schedule an appointment, or you can walk in if it's urgent. So let's talk a little bit further about whether you're dealing with an urgent situation. If you feel like you are distressed and you need to talk to someone the same day, you can walk in at our Uptown location, that building number 14, and we have therapists available to speak with you during our entire business hours. That's 8:30 to 5, Monday through Friday. Our clinicians will talk with you to determine what would be the next best steps to deal with your situation, and we will make sure to connect you with whatever resources you need to help you out. Now, if you have some concerns after hours, we'd like you to know about our new 24/7 support called The Line. This is a line that's staffed by the Baton Rouge Crisis Center, and they are professionals who are there to help you no matter what your issues might be. It's not simply a suicide hotline. It could be anything that might be distressing you. If you've had maybe a breakup of a relationship and it's 3 o'clock in the morning and you really want to talk it through with somebody, you can call the line. Perhaps you're struggling with your dissertation or things aren't going well in a particular class and you just like to talk that through. Also, you can just call the line. Anytime, day or night, someone will be there to assist you. And if there are additional resources that might be appropriate to help you with your concerns, the folks at the line would be able to direct you to the right place. Now, when you come to CAPS for your first appointment, you will meet with a consultant. And the purpose of the consultation is to really allow us to get a picture of what you might be dealing with at the moment. So after our consultant asks you a series of questions, that you will consult the two of you together on a plan. So next steps could be, and these include all the different resources that I mentioned previously. You might have an intake next to begin short-term therapy at CAPS, and you would be entitled to up to 12 sessions per academic year in our clinic. You might be appropriate and desire to join a particular kind of group, and I'll detail that in a minute. Psychiatric medication might be appropriate for you, so we would set you up with one of our psychiatrists for an evaluation. In many cases, we find that our students might be better served in the community over a longer term and can continue to meet on a weekly basis for as long as they'd like. So we set them up with a provider in the community. And depending upon the variety of concerns that students come in with, we may also connect them with other services on campus, such as the Success Tutoring Center, Student Resources Support Service, or academic advising. Now, I want to talk a second about our groups. We have a new set of groups for this fall. Now, the Know Thyself Interpersonal Process group is for those students who are dealing with maybe situations on how to get along with other people. Maybe you've been having trouble with your roommate and you just want some feedback on, gee, give me some tips on how I can do better coping with other folks. This group would be good for you. But particularly if you have body image issues or eating issues, we have the reflections group for those concerns. Take action on depression and anxiety is also another group that would be appropriate for graduate and professional students who are dealing with those issues. We have a sexual violence survivor group. We have an RA group that is for our undergraduate students, so wouldn't necessarily be appropriate for you unless for some reason you have a role as an RA. We have a journey with grief and loss group, and that's for students who have had losses and they would like some support around processing the losses. This group would be for you. I run a dissertation progress group, and we just started one on the downtown campus. Now, those groups are closed for the semester, but if you're interested in a dissertation progress group, keep your eyes open, and we will be advertising that opportunity again in the spring. And finally, we have our Spectrum group, and the Spectrum group is support for our transgender students or gender diverse, gender questioning students. Now, let me talk a bit about our care coordinator. Paige Theriot, who is one of our social workers, works with students to find providers in the community. So one thing I do want to make clear, some of our graduate students who do not pay the student health fee because they are part-time students and would not automatically be charged that fee, would not necessarily be eligible for psychotherapy or psychiatric services at our clinic unless they wanted to pay the fee. Graduate and professional students, regardless of paying the fee or not, are always welcome to come to our clinic with an urgent concern on walk-in, or they can get a consultation and then be directed toward community care if that's appropriate, or whatever services might make sense. So in that case, you can also use Paige Theriot, again, without paying the student health fee, to help you connect with resources in the community. So if you want to go see providers in the community, Paige will work with you. She will ask you about your insurance. She will ask you about different preferences as far as male or female therapists or location and so forth. And then she will provide you with a list of potential clinicians that might serve you. And she will work with you until you connect successfully in the community, until you no longer need her help. So if you have any more questions or want more details about our services, you can find us on our newly updated website, wavehealth.tulane.edu, and go to the CAPS pages, and you will see much of the information I will have presented here today. Thank you very much, and I would like to now turn the presentation over to Lindsay Greason, who is the director of the WELL.
Thank you, Donna. Hello, everyone. My name is Lindsay Greason, and as she mentioned, I serve as director of the Center for Wellness and Health Promotion, known on campus as the WELL. I am a health educator by trade and have my certified health education specialist certification. And for the next couple slides, we'll outline for you all what we do at the WELL and a couple other initiatives we have going on just for graduate and professional students. So, thank you. So at the WELL, our purpose, we are really devoted to engaging the Tulane community and creating a healthier campus, building individual capacity for health, and reducing barriers to wellness. We embrace a positive, holistic, social justice-oriented definition of health and provide research-informed programming that acknowledges that well-being, engaged learning, academic success, citizenship, and openness to diversity are all very connected. I think it's important to emphasize at the WELL, we really try to be positive, and so our approach to working with graduate and professional students is really try to outline opportunities for how they can stay healthy and well rather than to tell students what not to do. We're non-judgmental, and we also take a social justice perspective, really recognizing that in order for us to help keep our community well, we have to be inclusive with our services and try to look at promoting health equity among all students. Within our staff at the Well, we have a team of certified health education specialists as well as a licensed clinical social worker. We have professionals in the field of public health, higher education, science, and social work. We also have a group of 47 Tulane University peer health educators. Most of them are undergraduates, and they help us to get out the word about health and wellness. So if you're working with any undergraduates, we encourage you to let them know about that program. The next thing I want to talk to you about is our priority areas. As Dr. Timms was talking earlier, mentioning that there are many different aspects of well-being that we have to really focus on in order to keep our students healthy and well. We look at lots of different data points to see where are our graduate and professional health students struggling and where could they use some additional support, and that's how we set our priority areas. And so next I'll be outlining the programs and services that we do to outline and address these 5 content areas. The first one is substance abuse prevention. We also do a lot of work to try to promote holistic sexuality and sexual health promotion. We have comprehensive initiatives to support mental well-being on our campus. We partner within the Division of Student Affairs as well as faculty members and students to try to look at how can we create a campus culture that supports emotional and mental well-being. We also do tobacco cessation, and then we also do a lot of work around gender-based violence prevention. The next slide I have, we divided up what we kind of do in terms of health and wellness for uptown and downtown specifically, recognizing that we are going to have students from both locations on this webinar. We wanted to try to get as specific as possible in outlining that. So while we just wait for the slide to transition, I'll go ahead and start talking a little bit about what we offer to graduate and professional students uptown. One of the things we offer to our students is a variety of resources. So we have safer sex supplies at the Well as the Student Health Center, where students can stop by and receive free dental dams, inner and outer condoms, as well as lubrication. We offer some supplies for students with health messages on them, and we also have a section on our website called eHealth Promotion, recognizing that students can't always come to us, that we want to go to them. So we encourage you to go on that section of our website, and this is for uptown and downtown students. And they can go on there to get online gatekeeper training to train and learn how to recognize signs of psychological distress among their peers and refer them to help resources. We also have recordings for mindfulness. If you're ever looking to calm down in order to study and concentrate, there's also some recordings on there for sleep promotion. Each month we have health communication, and we have one just for you all. It's called the Graduate and Professional Student Health Wave, and so we encourage you to look for that each month in your inbox to get an update on what's going on within campus health, as well as some content relevant to that time of year and that time of the semester. We also offer workshops uptown that graduate students are invited and encouraged to attend. We have a 4-week positive living course that is offered 3 times throughout the semester. If you're interested in registering for that, you can go to wavehealth.tulane.edu and visit the Wells website and click on mindfulness to see the dates and times. It changes each semester, but that's something that we will always offer, and it tends to be popular with graduate and professional students. We also offer a drop-in on Fridays at 1 p.m. if you're interested in doing that, and you can always check our website for updates semester to semester. One thing we have within the Division of Student Affairs is an initiative called One Wave that is a bystander intervention and community mobilization program. You may have seen it on your syllabus. Graduate students are welcome to attend those workshops if you are looking to get trained on bystander intervention in order to intervene in high-risk situations. and also graduate student organizations can invite us in for that training. If you're a member of a graduate and professional student organization, there's a program called Do More Than Change the Channel that can be really good for you all. It's a values-based workshop that really gets at the norms within an organization and can cover material related to all 5 of our priority areas. So know that that is available for you all. And then we also have a self-care workshop that is by request that talks about how you can care for yourself so that you can really, manage stress and sleep and have some concrete self-care techniques so you can really study and thrive at your time at Tulane. We also offer a variety of services to our Uptown graduate and professional students. One of those is called Basics, which is a brief alcohol screening and intervention for college students. If you're interested in exploring your alcohol use 101 with a health educator, we encourage you to take that. We coordinate TIPS, which is a program that allows you to understand risk management for social situations that involve alcohol. You have to have a sober event monitor when there are programs with alcohol, and so this is the programming that allows students to be those monitors and can attend those events as a sober event monitor. We offer GYT on Fridays in partnership with the Student Health Center. You can schedule online for that appointment. And we also, you have to call for the GYT appointment, so you can call the Student Health Center. And then we offer at the Well tobacco cessation for students who are looking to quit. We are a tobacco-free campus, and so with that, we want to make sure students feel supported in quitting, and so that is a service that is free for graduate and professional students. We also offer a variety of events for all of our students that folks are welcome to attend. You can get a full list of our events by visiting wavehealth.tulane.edu or visiting OrgSync. Downtown, you can see we offer a lot of the same services. When it comes to workshops, we're happy to come downtown to you all. We have the same workshops that we can offer. At this point, we don't offer mindfulness downtown. We are looking to expand that program to include a downtown location, but students are welcome to come uptown to attend any of those sessions or drop-ins. We also offer Get Yourself Tested GYT downtown. November 2nd will be the date for the fall 2015 calendar year, and so if you are available, you can call and make an appointment 9 a.m. to noon, and it is free STI screening for chlamydia, gonorrhea, and HIV. Also, we host a variety of events downtown where we really try to look at some stressful times and offer study breaks for you all down there. Our one for the fall 2015 semester will be December 4th in the Diebold Gallery, and we invite you to join us for that. Next, I want to highlight a couple initiatives just for graduate and professional students that we are partnering with a variety of campus partners on. The first one I want to mention is Mindful Lawyering, and this is offered each semester, and I put the dates and times for the fall 2015 offerings on the slide here. We invite you, if you are a Tulane Law student, to email Colleen in order to register. That is taught by 2 professors within the law school who are part of the Mindful Collaborative out of Tulane University. And so we invite you to do that. And if you want to look each semester, it is on our website where you can get that if you're listening to this in the spring of 2016 or something. Also want to mention we have Dr. Ken Ginsberg coming to Tulane University at the end of October. And I wanted to put this schedule of events that we had up here for you all. He really talks a lot about fostering resilience. We have a special program downtown for the School of Social Work. And then we also have a student workshop that folks are welcome to attend on October 22nd in the evening, where we will be providing food. Registration is required, and so again, visit our website for details on that, but it can be really useful for many different graduate and professional students, no matter what field you're entering in, to learn a little bit more about fostering resilience within yourself, as well as the people you may be working with. Next thing I want to highlight is that at Tulane University, in about June 2015, we launched a new alcohol policy that had been in the works for many years with the leadership of Dr. Timms. And we really looked at, what is our data saying around graduate and professional students? And we saw that this is a chart where we look at the consequences due to drinking alcohol just for graduate and professional students. Sometimes we think about that as just an undergrad issue, but we know that it does impact your population as well. So you can see here the top 4 negative consequences as it relates to drinking alcohol. And these are things that we hope with more environmental management at Tulane, we can help to offset. And so if you go to alcohol.tulane.edu, there's a section on there under rules, policies, and response just for graduate students that allows you to see what the policies are regarding your population. Also on there, there's a lot of information that you can explore. It includes the responsible action protocol that is outlined under alcohol emergencies. There's support resources on there, as well as marketing and presentations if you're interested in that. We have a full webinar on the new alcohol policy if you're interested in getting more information about that. We know that for graduate and professional students, you guys are located all over our New Orleans community. So we really invite you to stay connected with us online. We have put up here for you our Facebook, Twitter, Instagram, and YouTube account, so you can stay up to date on all of our events and services throughout the year. Please take a second after this webinar to find us on social media, so again, you can stay up to date. A few of us have mentioned the website that we have for campus health departments. So I wanted to make sure you guys had a glimpse at what that looked like. This is wavehealth.tulane.edu. You may want to bookmark it on your browser so you can always access it. Our 3 units you can see are represented there. On the right-hand tab, there's a calendar of events that will also help you stay tuned to what's going on. There's also a tab on there on the right-hand side that allows you to request workshops. So we invite you to do that. If you are looking for information about locations and phone numbers, that is also on there. So we invite you to do that. To wrap up, we just wanted to highlight again our location so you could find us. The well for the Uptown campus is in Suite 115 of Riley on the ground floor. The Uptown Student Health Center is in Building 92, and as Dr. Bender said earlier, Counseling and Psychological Services is in Building 14 on the academic quad. You can also see that downtown we are at 127 Elk Place, and so we put a map on there for you all to be able to find us. We invite you to stop by any of our locations in order to seek services and get the support that you need and deserve. We're all very willing to, work with you, talk with you about anything at any time. So we did want to share with you all our phone numbers. If you're calling to talk with the director, you can call and ask for us, or you can just call and get more information by calling those numbers on there as well. And again, there is our website. So with that, we will wrap up and allow folks to answer or to ask any questions that they have. If you have any, you are invited to type them in at this time, and we will answer those.
All right, well, thank you all. We appreciate your time today. We hope you found this information informative. This will be posted on our website within the next couple of days, so wavehealth.tulane.edu. If you have any further questions, feel free to reach out to any of our resources or to any one of us individually, and we'd be happy to help you. Thanks, and have a great day.